What's up, TUMNAD lectures? In today's video, you're gonna talk about the urinary bladder. But please, if it is your very first time to watch me, make sure you first subscribe. You turn on the notification bell so that whenever I load the video, you become the very first person to watch. So let's go ahead and get started and look about what we call the urinary bladder. We are going to be talking more of the anatomy of what we call the urinary bladder. Now, when you see this urine bladder, is super situated in what we call the pelvic cavity. But we want to first look at the anatomical makeup and see its accessory structures, which is going to be allowing the out movement of urine. Okay, now how important is this urine bladder? Okay, the urine bladder primarily is responsible for what we call storage of urine. Okay, is what is possible for what we call storage of urine. That is one of the most primary role of the urine bladder. And then another one is what we call urine expulsion. Okay, urine expulsion. Okay, now let us first look at the anatomical makeup of this. We really understand its anatomy. Okay, now when you see these tube-like structures that are going to be coming from what we call the kidneys, from up descending down, carrying urine into the urine bladder, these kind of tube-like structures, how do we call them? They call these structures, or these tube-like structures, they call them as the urethra. Okay, they call them as the urethra. Okay, and of course they are going to be two, one from this side, another one from this side. They are going to be passing and enter from behind. Okay, they enter from behind. Okay, now how about this number two? We have this muscular layer of this muscular layer of what we call the urine bladder. How do we call that kind of the muscular layer? They call that one as a detrusor, detrusor muscle. Okay, is what we call the detrusor muscle, and it is a smooth muscle. Okay. Now, when we come to number three, when you see these openings, these are the openings of what we call the ureter. The ureter comes and then enters from behind. Then you're going to be seeing these kind of openings towards this down area. How do we call these kind of openings? They call these ones as what we call ureteral orifice. Okay, ureteral orifice. Okay, or you may even call them the ureteral openings. Okay, you may even call them ureteral openings. Okay, ureteral openings. It is through these ureteral openings that the urine in the ureters enters what we call the urine bladder. Okay, then number four, when you see number four, we have this kind of this triangular arrangement between the two ureteral openings and then the internal urethral orifice. So they make this kind of triangular arrangement. How do we call that kind of triangular arrangement? They call that one as the trigon. Okay, they call that one as the trigon. Okay, so number four is the trigon. Now, coming back to number five, when you see this number five, we have a smooth muscle which is going to be located in the neck of this bladder. Okay, how do we call that kind of the smooth muscle which is located in the neck of this urine bladder? This one is what we call the internal urethral sphincter. Okay, what we call the internal urethral sphincter. Okay, then when we come to number six, we have this kind of bulbar structure, which is going to be now allowing the passage of what we call the urethra. How do we call this kind of this bulbar structure? Number six, this is what we call the prostate gland. Okay, this is what we call the prostate gland. Okay. Now, coming to number seven. When you come to number seven here, you have just immediately after leaving what we call the prostate gland, we have this kind of space here before reaching what we call the penile area. We have this kind of small area. How do we call this kind of small area? where we are going to be having again another skeletal muscle residing. How do we call the whole of this area? Number 7. They call that one as a urogenital diaphragm. Okay, urogenital diaphragm. Okay. Now it is within this urogenital diaphragm where we are going to be having this kind of the skeletal muscles. Okay, this kind of skeletal muscles, number 8. How do we call these skeletal muscles that are located in what we call urogenital diaphragm? They call those ones as what we call external, urethral sphincter. Okay, external urethral sphincter. Okay, and of course it's going to be a skeletal muscles, meaning that being skeletal muscles, we have what we call voluntary control towards it. Okay, we can control it voluntarily, but of course this internal urethral sphincter is going to be under involuntary control. Okay, now coming back to number 9. When you come back to number 9, we have this kind of the whole of this tube. Okay, the whole of this tube. From this, the whole of this tube. Okay, the whole of this tube. How do we call the whole of this tube? From the internal urethral opening down into the external urethral opening. How do we call the whole of that tube? That tube is what we call urethra. Okay, is what we call the urethra. And of course, we are going to be having different types of the urethras as we are going to see. Okay, we have 3 types of the urethras. Okay, now how about number 10? Now towards the entrance, we have this kind of the bulbous tissue-like structure. This is what we call the glans pens. Okay, now having looked at the anatomical structural location of these different parts of the urinary bladder, and of course at the back of your mind you have to be knowing that this is going to be the urinary bladder for males. Okay, it's going to be a urinary bladder for the males. Why am I saying this? When you see on the length of the urethra, the difference between the male and the female urinary bladder, we are going to be checking on the length of the urethra. Okay. But before that, let us first look at now the different types of the urethras that are going to be residing between the internal urethral orifice and then the external urethral orifice. Okay? Now, coming here in what we call the type of the urethra, which is going to be residing inside the prostate gland. How do we call this kind of the urethra, which is going to be residing inside the urethra, inside what we call the prostate gland? This part, this type of the urethra, which is located in between the prostate gland, this is what we call prostatic. Is what we call prostatic. What we call prostatic urethra. Okay, is what we call prostatic urethra. And on average, this prostatic urethra is going to be approximately around 3 centimeters. Okay, it's going to be approximately around 3 centimeters. So now we can have another type of the urethra which is going to be within what we call the urogenital diaphragm. In between what we call the external urethral sphincter, we have that kind of the urethra. So now this type of the urethra which is located within the urogenital diaphragm. They call that one as the membranous urethra. Okay, they call that one as a membranous. They call that one as membranous urethra. Okay, and on average, the membranous urethra is approximately around 1 to 2 centimeters. Okay, 1 to 2 centimeters. And again, you're going to be having now another type of the urethra, which is going to be the longest, that is located in between the penis. Okay, that kind of the urethra which is going to be in between the penis, from the urogenital diaphragm going down up to the outside towards the glans penis. How do we call that kind of urethra? They call that one as what we call the penile urethra. And the penile urethra is the longest. Okay, the penile urethra is the longest, and it's going to be approximately around 15 centimeters. Okay. Now, having looked at that, what is generally the length of the urethra? Generally, the length of the urethra in male, okay, in male, the length of the urethra is between 18 to 20 centimeters, okay, within 18 to 20 centimeters. How about for the case of female? It is a bit very short, very short. It is somewhere between 3 to 4 centimeters, okay, and this explains the reason why females are so much prone with what we call the urinary tract infections, okay. Now, having looked at all that, how big or what is the capacity of the urinary bladder, okay. Looking at the size of the urinary bladder, this urinary bladder can accommodate urine approximately between 400 to 600 mils. Okay, it can accommodate between 400 to 600 mils. But of course, this is going to not be a standard value. It can even accommodate even up to 700 mils. Okay, but of course, as the urine starts accumulating in the urine bladder, again, we shall be having what we call the urge to go and void. Okay, so now let's have just a simple quick recap. So now we have said that this urinary bladder is going to be located in what we call the pelvic cavity. We have the following parts that make up the urinary bladder with the extension of the urethra. We said that the whole of this area up to this point, the whole of this area, okay, is what we call the body of the urethra. And then towards this kind of small invagination around this area, this is going to be the neck of the urinary bladder, okay. That is something which is very important. The whole of this area is going to be the body, and then this one here is going to be the neck of the urinary bladder, okay. So now a quick recap: you're going to be having number one, this is going to be our ureter. Then number two is going to be our muscular layer, which is going to be the detrusor. Then number three is going to be what we call the urethral orifice or openings. Then number four is going to be our triangular arrangement, what we're calling the trigon. Then number five is going to be what we call the internal urethral sphincter. Number six is going to be now our prostate gland. Number seven is going to be now the urogenital diaphragm. Number eight, we have that kind of skeletal muscles located within the urogenital diaphragm, which we are calling the external urethral sphincter. Then number nine is going to be now the whole of this tube, which is the urethra, and then finally the glands beds. That is just a really anatomical structure of what we call the urine bladder. And we have said that we have three types of the urethras, whereby we have this one, the one which is going to be located in between the prostate gland. We said is the prostatic urethra, which is approximately around 3 centimeters. And then we have this kind of urethra, which is going to be in between the external urethral sphincter around the genital diaphragm. We said is what we call the membranous urethra, which is about 1 to 2 centimeters. And again, we said the one which is residing inside the penis. We said that one is called the penile urethra, which is the longest, around 15 centimeters. And we said generally the whole of the urethra for the case of male is going to be around 18 to 20 centimeters. And again for females, it's going to be around 3 to 4 centimeters. And this explains why UTI is always so much common in females, just because of their short urethra, okay. And again, we talked about the functions of the urinary bladder. We said the primary role of the urinary bladder is the storage of urine, and also the urine expulsion. Of course, when the bladder gets full, of course, under the influence of the nervous system, we're going to be having the contraction of the detrusor muscle, which is going to be aiding in the downward expulsion of urine through the urethra out into what we call the surrounding environment, and that process is what we call the micturition. So again, you're going to be talking about the micturition in the next video, okay. That covers a simple anatomy of what we call the urinary bladder. But please, if you find that this video has helped you, has made you to understand something, please support me. You can do that by liking the video, commenting down in the comment section, sharing the video, and don't forget to subscribe. TUMNAD, as always, until we meet next time.